Hi, everyone. Welcome today to Tattoos and Telehealth with me, Nicole Baldwin, and Kelly White. And we're both board certified nurse practitioners. And this is our podcast for today. We're going to talk about ADHD and telehealth. We're going to get into a little bit of details. It's going to be a quick podcast, something you can listen to quick. Just be mindful this does not constitute a patient provider relationship. And this is not to be construed as medical advice. We're just two girls just talking, and you're happy to listen. So, Kelly, if you want to get started on ADHD and telehealth, and it's definitely something that has a lot of intricacies to it and varies state by state. So, I'll let you take it.
Absolutely. So one of the things I wanted to be sure that our listeners understood is that you absolutely can access services to telehealth for ADHD. It's not something you have to be seen for in person. It's just as if you were here for a mental health exam. If you guys are following us, you've heard us talk about being seen for anxiety, depression, etc. You can be seen via telemedicine for ADHD. The big differences that you're going to see is whether or not you take a stimulant medication. That's where the lines are kind of drawn in the sand about, whether or not you have to be seen in person and when you need to be seen in person. Several states, again, check with your state, find out what your regulations are. Your providers are going to know this state to state, whether they're licensed there, they know what the regulations are. But I even have some colleagues that work via telemedicine that prescribe stimulant medication and they know what the regulations are. Like maybe you have to see your provider in person once every 6 months or once every 3 months or once every 30 days or whatever. But you can still be seen via telemedicine. That's not something that you have to worry about. But there are alternatives to stimulant medication. Nicole, I know that we've chatted about this. You have prescribed non-stimulant medication for ADHD patients via telemedicine, right?
Correct. For mild ADHD, I'll do Wellbutrin, but Strattera is another option. Atomoxetine. Patients do very well on that. It's easier to get because it's not a stimulant, it's not controlled. And so patients have been doing pretty well and responding well to that, and it doesn't come with the side effects of the stimulant. So it's been pretty good.
Yeah. And we've chatted about repurposed medications. So there's other medications you can take that help with ADHD. And then there's also some other alternatives that you can try. And also, don't be afraid to seek alternative options for your ADHD, guys. There is so much out there, and there are ways that you can treat your ADHD from a holistic standpoint. Nicole and I, we have this rule, your body, your rules. You come to us, we're going to give you the facts, we're going to talk to you about what your options are, and we're going to support you in your decisions. This is it's your body. These are your rules. And if it won't hurt you, we are happy to support you in your journey and whatever you decide to do. And so we just wanted to pop on here, make sure you guys understood that ADHD does not have to be seen in person. The questionnaires that you would fill out in person, we can flip that to you through the portal, through a patient portal that we have you sign up for. You fill out the same questionnaire, we evaluate the same questionnaire, we're going to chat with you. We're going to still do the same screenings. We're going to still check in with you. So don't feel like just because you may have what you think is a complicated diagnosis of ADHD that you have to go be seen in person and sit in waiting rooms and wait hours to be seen. Telehealth is an option, guys. Telehealth is something that you can pop in, be seen for, and go on about your business. Absolutely.
Yeah, absolutely. And please reach out to us. We're happy to help you. You can establish a patient provider relationship at hamiltontelehealth.com. You can find Kelly and I both there. And let us know if you have any questions. We'll certainly be happy to assist anyone out there or just answer any questions. So
All right, guys. Short and sweet. I hope you have a great rest of your day.
have a good day.